Have you ever heard the saying, you can't pour from an empty cup? Well, let's talk about that and what it means for public health leaders, especially during challenging times. You're listening to the PHEC podcast, episode 414. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports nonprofit organizations, community health foundations, and government agencies. With 25 plus years of experience in healthcare and public health, I've learned that sustainable impact requires strong, supported teams. One of my specialties is capacity building through workshops that help public health organizations navigate uncertainty and thrive during challenging times. Now, on this episode, I'm sharing an example of a workshop that I facilitated on leadership, wellness, and team resilience. And by the way, let's connect if this resonates with you. I'd love to explore how we might be able to support your organization as well. Links to connect with me will be provided in the show notes for this episode. Let's talk about what I refer to as pouring from an empty cup. Now, I don't really know where to give credit to this phrase from. I always heard my mother and my grandmother and people in our church talking about this when I was growing up, and it's something I've just heard my whole life. So I'm curious, have you ever heard the saying or the phrase, you can't pour from an empty cup? Well, let me give a brief explanation just in case you haven't, but what I understand that to mean is the importance of pouring into yourself. You have to take care of yourself first. You can't really be of service to someone else if you're not taking care of yourself. So if you're not well, it's very difficult for you to take care of someone else who may need your help or support. Now, as public health professionals, we are a group of people who are very heart-centered. We naturally care about others. We're thinking about the people that we serve and the population that we care so much, the problem that we see. It's very natural professionally, personally, that's our go-to reaction. We're thinking about the people around us first. It comes naturally for us to do that. And in the challenging times that we're living in, depending on what time you're listening to this, I'm sure there's some challenges going on. So we're almost always in a state of having challenges. But right now, in 2025 especially, we're in some very challenging times. And we will be thinking about the people around us and what we need to do and the problems we need to solve and how we need to fix these issues. And we're just running on empty. Our cup is becoming low. The things that we normally would do to pour into ourselves, we're probably not thinking about it as much, or we're putting it off because we feel like we're going from chaos to chaos and crisis to crisis. But that's not sustainable, because if we do not refill our cups, then what do we have to give to anyone else or any cause or fight or challenge? Now, we know this, yet we still operate in this cycle. So I'm not really beating you up. I mean, this is me. But what I am trying to do on this episode is share with you a story. And I hope that it will kind of get your attention and help you reframe or rethink some things. Because sometimes what you do to refill and refuel and pause and kind of recharge your battery, sometimes we have to change what that is because it doesn't quite work. So maybe before we got to this state of chaos in the year 2025, maybe what you did worked for you. You could do yoga, you could take a walk, you could do all these things that would help you refuel and pour into yourself, and then you're ready to go back to work. And maybe during this time, that doesn't quite do it. So if you find yourself in that situation, then I challenge you to find what works for you now. Sometimes we have to rethink the systems. Okay. So let me go into this a little bit further. Here's the story that I want to be able to share with you. Now, again, I'm recording this in the summer of 2025, and we are without a doubt living in some very challenging times. At this point, it doesn't matter where you are in the world. The times are challenging. For us here in the United States, it's complicated because our presidential administration does not seem to work well with public health, and there are just so many challenges. And that's putting it really nicely and mildly. But that being said, the weight of serving communities can feel overwhelming, but that's also what keeps me energized. The opportunity to lift up others along the way. And I'm sure a lot of you feel the same way. Now, this summer, I've been traveling across our country, facilitating workshops with dedicated public health teams. There's something really powerful about connecting with people who share your mission. And that is what it's like with all of the clients that we partner with, the clients that we have through our consulting firm. These are our clients. We connect with a shared mission. Our company's mission and values align with our clients in many ways, and that makes it such a very unique connection. And I get to support them. I get to show up and support them and help them, and I'm often invited to do so, and they refill my cup in return. So let me also add a little bit of personal backstory here to add to the complexity of this time that I'm describing. So the client that I'm referring to in this example is the Tribal Epidemiology Centers. And if you've been listening to this podcast for a while, you've heard them on different episodes. We started partnering with them back in 2021 on this podcast, as special sponsored episodes or special featured episodes. I would interview different people from there are 12 Tribal Epidemiology Centers. And on this podcast, we've had guests from all 12, and sometimes we've had multiple guests from different TECs. They're referred to Tribal Epidemiology Centers, TEC, so we TECs for short, if you hear me say that. So we started having those featured episodes on this podcast. And then a couple of years ago, we launched their own podcast. We repurpose those episodes. They have their own podcast called Tribal Epidemiology Centers Podcast that our company produces, and we still support those episodes. In fact, we're in the process of recording new episodes that are going to be coming out very soon for their podcast. So that has been a very long relationship over the process of, I think we have about 30 episodes that have been produced at this point. So that's been a very long process, a long time that we've worked with them. I've also facilitated workshops for the Tribal Epidemiology Center's leadership. So in Albuquerque, at the end of 2023, I traveled there to facilitate a workshop, leadership focused for their leadership. So this was leadership from each of the 12 Tribal Epidemiology Centers came together for a conference in Albuquerque. And it was a wonderful time. It was an opportunity to have them in the room. And some I'd already met before at other conferences, and some I was meeting for the first time. And it was a 3-day conference. And I had 2 days they worked on strictly strategic planning. And that third day, I facilitated my leadership workshop. And it was really well received and a great experience. So another opportunity to pour into the organizations, plural, because they do represent 12 individual organizations, sort of under one umbrella. And then for the beginning of this year, I was invited back for another Tribal Epidemiology Center conference. And this time they decided to expand the conference and have more people from all of the TECs come along with some of their CDC partners. We were really excited. Actually started planning this toward the end of 2024 and was really excited about traveling to San Diego for that conference in February. Actually, I'd already been in San Diego. I was working for some other projects, but I was supposed to that was one of multiple projects that I was working on in San Diego during that time. However, that conference from February was rescheduled to June. And everyone remembers when we got to the end of January, how the immediate gutting out of public health began to happen and all the cuts and just the dramatic changes across the board for public health. So we ended up rescheduling that conference to June. So when we got to, or as we started to approach the beginning of June and started looking forward to, and of course the conference changed a bit just because of so many program shifts and changes that happened because of this administration's gutting out of systems. So the conference changed a little bit, but we're all ready for that event and started to gear up for it. So in this last minute shift in the agenda, it provided an opportunity for me to help kind of fill a gap. I was able to share, in the last minute, this, I know that planners were a little frazzled because of some changes and people that were supposed to be there in the program that could not be there. And I, raised my hand to support this organization that I've become so connected with over the years. It was an opportunity for me to really partner and help fill a gap, and the show must go on. It worked out beautifully. I partnered with someone that I knew of but had not worked that closely with, who turned out to be just a wonderful new colleague and friend. And we had a lot of fun meeting that need and filling in a space that had been left vacant beyond no one else's control. But it was a great opportunity, and it worked out, really, really well. So, that last minute little bit of a rush gave me an opportunity to show up even more for my client. Now, on a personal level, this is the part I'm going to be a little vulnerable and open with you, because we all have some of our own personal challenges that are going on in life, along with whatever's happening in our professional world. So for me, the month of May was hard. It was nothing that I could have prepared for, planned for. I didn't even expect it to hit quite the way that it did. So May is already a very full month for my family. A lot of birthdays, my anniversary. But this was the first Mother's Day after losing our son at the end of last year, or last August. And I don't talk about it all the time on the episodes, but I have been very open with you all about the grief journey and how complicated it is. Well, the month of May took it to a whole new level of complication. So just to put in context, not only was it the first Mother's Day, since we lost our son, it was also my mother's birthday is in May, and my mother's birthday and Nick's birthday are only like a few days apart. And I lost my mother in 2023. We lost Nick in 2024. So this year was a little rough. So just to add to that, we start the month off with my husband and I celebrating our wedding anniversary is the beginning of May, which is exciting and wonderful. And then we have Mother's Day. And then a couple of days later was my birthday. And you want to be excited about your birthday, but it wasn't really exciting. And then right after that was my mother's birthday, and that, triggering, and then Nick's birthday. So all of that was within from Mother's Day to Nick's birthday was probably about a span of 10 days. So I break it all down to say that it was an emotional roller coaster. And those complex layers of grief, that's just real. There's so many unexpected twists and turns when you're on a grief journey. And then when it's complicated with, so my mother and my child, and it was a lot. And I say this because while I am on this emotional roller coaster, and I do mean the highest of highs, I'm really excited about. We tried to approach it being, so prepared, and we had worked with our individual therapists, and we had done all the stuff that we knew to do, and we had decided we're going to have a positive outlook, and we're going to be, sharing memories, and we held some space for what would happen, but we had no idea that we would go from the highest of feeling great and excited, celebrating our anniversary, to the drop of a roller coaster and hit the bottom. And then we just, at some point, we lost all of our tools and resources, and it just felt raw. We still had our therapists and all that, but it just felt very raw going through it all. So everything that I had been doing to, really pour into myself, it would barely work, or it was just temporary, it was just a temporary fill. So my cup was empty. No doubt about it. It was empty. All my go-tos of walking and gardening and reading could only just keep me barely on the positive side of sanity, is what it felt like. And everything else was just going crazy. Not to mention, my professional life seemed to be just kind of spinning around me. Every time I, turned around, something was being cut, something was being reduced, this was going away. It was a lot, professionally, personally, the whole emotional roller coaster in the month of May was just over the top for me. So I say all that to say that by the time I got to the end of the month and I was, just kind of trying to hold on to get out of the month. I just felt like if I could get out of May, I'd be okay. I started to prepare for this trip to Southern California to facilitate this workshop. And I was looking forward to it, no doubt. And because, sometimes when you have something to do that's a little bigger than you, it's something that keeps you going. It gives you a reason to get up and to keep, trying. So I let go of a lot of things that I really didn't need to worry about. And I just focused on one day at a time and as much as I could do to kind of pour into myself. I kept doing the things, although it seemed like it wasn't really working, I kept doing the things that I knew to do. And then there's sometimes you have to let go of a lot of other stuff. So I hope this is like really landing with all of you. So getting back to, this trip, by the time I, got to the trip, I knew that it would be a great experience and I would be able to, I'd be able to pour into my client, to the organization and feel, I knew I'd feel good about it. But I just didn't realize at the time that supporting my client in this way was exactly what I needed. I knew it would be good, but I didn't know that it was such a, it was what I needed. So as I wrapped up the week of working in beautiful Southern California and I prepared to travel home, my heart was filled with gratitude. I had been invited back to serve as a workshop facilitator for an incredible group of professionals at the Tribal Epidemiology Centers once again. So that in itself was such an honor. I don't take that lightly. I mean, we should never take something like that lightly, but I was just so honored to have been invited back again. And yes, my workshop was very successful and I did receive some great feedback. People really participated and I got some really wonderful heartfelt feedback right there on the spot in the larger group as we wrapped up the event. So I knew that the workshop was successful and I had, delivered. I met new team members. I had some people that I had never met from some of the different techs and I caught up with those that I've known for a while. So it was really wonderful. You know how it is as public health professionals, we're like a big family. So when we get to a conference, sometimes it feels like a family reunion. So that was really a wonderful part of the experience. We shared meals together, we laughed together, and we shared great stories. I was welcomed into sacred spaces, and I was introduced to cultural experiences that were brand new to me. Once again, when you're invited into sacred spaces and really become a part of the culture, whatever group, culture, population you're working with, that's like the highest honor to be invited into spaces that you otherwise would not have been able to witness and partake in. So more than once, I was referred to as a part of the family, and I felt it. This is far greater than a professional success story. This experience fed my soul. So as I poured into them, they refilled my cup. So I'm truly grateful for my genuine long-term relationship of many years with amazing people across the 12 Tribal Epidemiology Centers. As I wrap up this episode, I want you to listen closely. So much of what is draining us right now is beyond our control. The takeaway that I hope all of you receive from this episode is to figure out and take action on whatever refills your cup so that you can continue to pour into the communities and causes you care most about. You can't pour from an empty cup. Now remember, if your organization is looking for this type of support in the area of leadership, wellness, team resilience, workshop facilitation, then please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. The links will be provided in the show notes. Now, the show notes page for this episode, which is episode 414, can be found at phecpodcast.com. And once you're there, just navigate to episode 414 to find the show notes. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.